Noesa. Overview. Noesa is a traditional medical term, referring to a condition where a continuous stream of clear fluid leaks from the nose. In modern medicine, this is often associated with cerebrospinal fluid, rhinorrhea, or severe forms of chronic rhinitis. It is called brain leakage because the fluid was historically thought to flow down from the brain. Causes. From a modern medical perspective, causes include head trauma, skull-base fractures, tumors, or complications from sinus surgery that create a hole, allowing cerebrospinal fluid to escape. In traditional Korean medicine, it is caused by wind and cold pathogens entering the brain, or a severe deficiency of lung and kidney energy failing to hold bodily fluids. Symptoms. The primary symptom is a constant dripping of clear and watery fluid from one or both nostrils. This fluid flow might increase when tilting the head forward or straining. Other symptoms can include headaches, a loss of smell, nasal congestion, and a foul odor in the nose. Diagnosis. Modern medicine diagnoses this through physical examinations, testing the nasal fluid for a specific protein called beta-2-transferrin, and imaging studies like computed tomography or magnetic resonance imaging to find the leak. Traditional medicine diagnoses based on pulse taking, observing the nasal discharge, and assessing overall body energy imbalances. Prognosis. If caused by minor trauma or energy deficiency, it may resolve with conservative treatment. However, if there is a significant structural tear leaking spinal fluid, there is a high risk of meningitis or brain infections, requiring prompt intervention. Modern medical treatment. Initial treatment involves bed rest and medications to lower brain fluid pressure. If the leakage does not stop after a few weeks, surgical repair of the skull-base defect is usually necessary. Endoscopic surgery through the nose is the most common and least invasive method. Korean medical treatment. Treatments focus on dispelling cold, wind from the head, and strengthening the lung and kidney systems. Acupuncture and herbal medicine are primarily used. Representative prescriptions include bibongtang and yeongyo. Must be prescribed with modifications according to individual constitution and symptoms. After diagnosis by a Korean medical doctor, lifestyle management. Patients should avoid blowing their nose forcefully. It is important to prevent constipation to avoid straining. During bowel movements, keeping the upper body slightly elevated. While sleeping can help reduce pressure in the head. Home remedies. Consuming warm ginger tea can help warm the body and support lung energy. Inhaling steam from warm water may soothe the nasal passages, but one should avoid putting any unprescribed liquids directly into the nose. Precautions. Do not ignore a constant clear runny nose, especially after a head injury. Seek immediate medical evaluation to rule out a spinal fluid leak. Avoid heavy lifting, vigorous coughing, or any activity that increases pressure inside the head until cleared by a doctor.